So the whole idea of the exam is, how can you take a step backwards, look at this patient, improve your examination skills so that you can try and decide what you think might be more the specific pain generator. Because back pain itself is just a symptom, it's not a condition. Yet there's deficiencies even in the literature, because you'll read a literature or a paper that'll say, we're looking at the efficacy of doing facet blocks for back pain. Well, that's great, except the paper should read, we're looking at the efficacy of doing facet blocks for facet-mediated pain. They're not doing that. You know, if you have a knee pathology, do you walk around and say, I have knee pain? No. I have an anterior cruciate ligament tear, or I have a medial meniscus tear. You're giving it more of a specific diagnosis and then doing a specific treatment. For back pain, people aren't doing that. So the whole purpose of this exam is to sharpen the clinician so that they can get a better idea of what might be a primary and a secondary pain generator, which would then help you target treatment better to that patient. Because do we have to do a series of facet blocks, let's say, to identify facet pain? No, you can bend the patient over an exam table and start palpating the facet joint, so when you hit one that's inflamed, you're going to know it pretty fast. You can observe your patients without even laying a hand on them or saying a word and start getting an idea what might be causing the pain sometimes. You know, patients that have acute facet inflammation, for example, tend to have a certain antalgic position that they're sitting leaning back, versus somebody who has an acute disc herniation compressing a nerve might be actually sitting leaning forward. So all you've done is go out into the waiting room to greet your patient, not say a word, and you're already getting information that adds to your clinical examination. Most people do examinations that are quite thin, if you will, and very vague. I think the most common orthopedic maneuver for evaluating the low back is called Lassegs, or straight leg raising. Even the authors who wrote the textbook say it's the most equivocal of any of the diagnostic tests. It might tell you there's a problem, but there's about 20 other maneuvers you can add to that then to tell you a little bit more about what the problem might be, but yet no one does those.